Hello everyone, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today.
In this talk, I will highlight the important updates in the field of electrophysiology in 2023. The field of heart rhythm witnessed significant developments and ongoing discussions surrounding treatment options for atrial fibrillation, AF, in 2023. From catheter ablation techniques to device therapies and drug advancements, the year brought both exciting breakthroughs and complex challenges. Catheter ablation takes center stage. Headline news in the realm of AF ablation came from the CASTLE-HTx trial, which demonstrated the benefits of the procedure for patients with advanced heart failure and potential candidates for heart transplantation or LV assist device implantation. Additionally, two pulsed field ablation (PFA) trials, PulseSelect and ADVENT, offered hope for shorter, safer procedures through electroporation instead of thermal energy ablation. PulseSelect showcased the safety and effectiveness of the PulseSelect system in both paroxysmal and persistent AF, leading to its approval by the FDA as the first PFA technology available in the US. ADVENT, presented at the European Society of Cardiology Congress, revealed the Farapulse system as non-inferior to thermal ablation, with less pulmonary vein narrowing and shorter procedure times. LAAO and AF management guidelines. Left atrial appendage occlusion, LAAO, for stroke prevention in AF patients continue to gain momentum. The Society for Cardiovascular Angiography and Interventions and the Heart Rhythm Society published an expert consensus statement providing evidence-based recommendations and incorporating recent advancements in techniques, devices, imaging, and trial data. Furthermore, the WATCH-TAVR trial demonstrated that adding LAAO during TAVI offered non-inferior outcomes compared to TAVI alone in patients with severe aortic stenosis and AF. These findings contributed to the updated US AF guidelines released in November, which strengthened recommendations surrounding both AF ablation and LAAO. Insights into medical therapies for AF. The year saw mixed results for various drug therapies targeting AF. NOAH-AFNET 6 showed Edoxaban failing to improve clinical outcomes and even increasing risks in patients with subclinical AF detected by implanted devices. Conversely, Artesia demonstrated the efficacy of Edoxaban in reducing stroke or systemic embolism but with increased major bleeding in similar patients. A subsequent meta-analysis indicated a trade-off. While DOACs reduced ischemic stroke, they also significantly increased major bleeding. The promising class of factor XI/SIA inhibitors faced mixed outcomes, with Azaleotimi 71 showcasing abelacimab's bleeding safety advantage over rivaroxaban, while Oceanic AF was halted due to asundexian's failure to outperform Edoxaban. Meanwhile, Rivera 201 presented positive results for a novel nasal spray containing etripamil in rapid ventricular rate AF patients. Surprisingly, the FRAIL AF trial revealed increased bleeding risks in FRAIL AF patients who switched from warfarin to DOACs. Focus on conduction system pacing and device innovations. The year saw continued evidence supporting conduction system pacing, including both left bundle branch area pacing, LBBAP, and his bundle pacing. A large observational study showed LBAP's superior clinical outcomes compared to biventricular pacing in CRT patients. Similarly, a hot CRT study demonstrated his bundle pacing's greater LV function improvement than biventricular pacing in CRT candidates. These advancements led to the inclusion of conduction system pacing in pacing guidelines from both the US and Europe, with the EHRA releasing a consensus statement on its implantation technique. The DANPACE 2 trial further explored optimal pacing rates in patients with sinus node dysfunction, revealing that reducing atrial pacing didn't lower AF risk but increased pre-syncope/syncope likelihood. Notably, the FDA approved the first extravascular implantable cardioverter defibrillator, EVICT, the Aurora EDICD with its Epsila EV defibrillation lead, offering an alternative to transvenous leads. In conclusion, 2023 proved a vibrant year for the field of heart rhythm, marked by significant advancements in ablation techniques, device innovations, and ongoing debates surrounding medical therapies. As research and development continue, the future holds promise for improved treatment options and enhanced outcomes for patients with atrial fibrillation.
Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.